have the pre-contrast on the left and the post on the right. What I really, really loved about this is I could see that in this case, this mass was not impinging on or destroying the cortex or the cortical bone here. And it really was sitting on top, kind of like a little hat. So that really helped with my surgical plan. I didn't really see any bony lysis or bony destruction.
He's got an ear tumor there, and you can make out the margins of that ear tumor. And I could see that it wasn't like into the middle ear extensively. It looked like it was right to the edge there. So we went ahead and we did surgery on this dog, and we removed that entire mass. We knew where we were at.
This is a gray parrot with a lymphoma neck mass. Okay, and we didn't know it was lymphoma until I went after it surgically. It's a very unusual presentation. So what you're seeing here is the right jugular vein wraps around in a very unusual direction here. We've got the, I'm going to show this again here, just so we can show around. We've got the right carotid, and we have the left carotid and left jugular. So the interesting thing was I had to use this so I knew where this vessel was. It may look obvious to you, but it's actually buried, and I literally had to dissect this vessel out of the tissue. There is no way I would have been able to do this and have this bird survive surgery had I not known where this vasculature was. This is why I really needed this high resolution imaging.
Anyone that's been practicing for a while, and especially if you're fairly aggressive as far as looking at things, you've gotten into some surgical cases going, geez, I wish I would have known about this. And this definitely lets you know what you're getting yourself into. It really helps with surgical planning. One of the things is it allows you to spatially orientate things that you're very limited with ultrasound and regular digital radiography. That's especially helpful if you're doing anything with orthopedics.
HDVI studies are the golden standard for patellar luxation. And remember, patellar luxation is a sign, is not a disease, and must be confirmed if it's occurred to the deformity of the femoral head, the femoral condylis, or the tibia, for which HDVI is essential. This is an example of an interpretation fragments relying on BPOP to make the measurements. Here, the doctor aligned each of the bones using the software Horus. This image, with the help of BPOP software, will help us to measure the exact angle of each of the bones. With this information, we can define which deviation is causing the patellar luxation to carry out an adequate surgical planning.
This was helpful because I wanted to look for any additional fractures. I wanted to see if there was any periodontal disease that would affect or compromise my fracture repair.
I almost never have to use MRI for spinal surgery now. Vimago gives me that answer very quickly, much quicker than the MRI. And I can view the material, for example, in 3D. And so I know exactly where my approach needs to be. And I know exactly what I expect to find.